know what time frame they're in, okay? You establish their orientation, and then while you're looking at them, you're also looking, you can do several things at one time. While you're looking at them, you're looking at their scalp.
Got dandruff.
That's all right. We all have some sort of ailment.
Yeah.
You're looking for any lumps, bumps, okay? You're looking for anything like that. Making sure the hair is of good quality, make sure it's not brittle, make sure it's not dry and breaking. You're going down, looking at the face, make sure it's symmetrical, it's not swollen on one side. You're looking at the eyes. I'm going to take my pen light. Let's see. Eyes, yeah. You know, I'm going to note if she's wearing glasses. If not, are you wearing contacts? Okay. And then I'm going to go ahead and take my pen light, dim the room. Always dim the room when you're checking for pupils. And then I'm going to go in, side, look, come around, side, look. Whilst you look straight ahead, okay? I'm going to look at the conjunctiva, make sure we're good and pink. I'm going to make sure she can follow my eyes, this kind of thing. I'm going to look at her nose, make sure we're symmetrical. Take my pen light and look up in there, make sure we have a good septum, make sure we're not bleeding, make sure nothing's going on. I'm going to look at her mouth. Is it symmetrical here? Okay, well, you don't know that. Okay. Okay, then I'm going to ask her to open her mouth. I'm going to take my pen light. Just open your mouth.
Well, I got to throw on the breathe on.
I have a granddaughter.
Okay.
Open wide. Okay, well, look at the, make sure we have no alterations, no open areas. I don't have any poor dental hygiene. Make sure all of our teeth are there. We're going to look at the ears while we're up in this area. Hold the pen light.
Make sure you brush your teeth that day.
Yeah, make sure you brush your teeth. We use-
You too. And I eat onions. Sorry.
Okay. Make sure the ears, look at the ears, make sure no drainage, make sure everything looks good there. Make sure we're symmetrical here. And by this, you want to make sure that it's lined up like this. You're going to look at the neck, make sure there's no,
I'm so sore. That feels so good.
oh, no swollen lymph nodes, okay? What else are we looking at here? Okay, we did nose, mouth, all right. Before I get started, I forgot on vital signs. Vital signs are stuff way over there. Before I get started, I'm also going to do a set of vital signs on her. And on your checkoff, you will do a full set of vital signs. I will have my teaching stethoscope with me. Okay, who has checked off on vital signs? Who has not? Okay, if you have not, you will not be required to do them. Okay, because you have not checked off. All right, then I'm going to, my gingerbread man. Okay, then I'm going to go ahead, I'm going to go down, check her skin before I listen to anything, because what's our first technique we do?
Wash your hands.
We inspect. Remember? We inspect.
Respect.
Okay, so I'm looking at her arms. You would see bruises on me.
Dog food did that.
Dog.
That's a cat.
Okay. Looking at nail beds. You want to see how her nail beds blanch out. Do a calf refill. We want to look and see if it's what? Less than what?
3 seconds.
Okay, we're going to look at swelling. Okay, we're going to look at her feet. Make sure we're not swelling down here. Look at her, and you're going to feel for pulses. Okay? Make sure we have our pulses intact. Make sure everything is going good. Okay? Now, once we get started with our inspection, and we looked at the skin, we've checked all that, we can now move on to what? Auscultation.
I'm listening. I have a question though.
Okay.
Are we just gonna say that we're gonna like palpate, like we're, you know, like how in the book it says palpate abdomen and all that? Or,
No, because on the abdomen, all you're going to do is do shape, any dressing, soft incisions, tender bowel
so
signs.
just literally like just do what you just did, move to your feet and check for pulses and.
And then you're going to come back and you're going to listen
Okay,
to the
that's what it's
systems, okay? So now I'm going to listen to her heart, okay? I'm going to go ahead and make sure that we're, number one, regular. I'm going to listen to all the areas. Okay, where's the PMI?
The fifth intercostal.
Fifth intercostal space. Okay, we're listening. She's good and regular. I'm going to listen for a minute for an apical pulse. Okay, that's what I'm going to do. Then I'm going to go ahead and go to her lungs. Deep breath in, out, again, out, listen to all 6 areas, including the sides. Okay? That's what I'm gonna do. All right, then, before I actually touch the belly, I'm gonna listen. Why?
Found that you don't have any holes.
Right.
Are you gonna check the
Or
back,
whatever.
Huh?
check the back for the lines and everything too?
Yeah, I have a question. You want it on front or back?
Both.
Okay.
Yeah, both on back. Because this is gonna hear more posterior, this is gonna hear more anterior.
Okay.
Okay, now we'll listen to the belly. Okay, sit back just a hair. We're gonna listen to all 4 vowel sounds, all 4 quadrants, excuse me. Quit. I shall go down and help you. Okay,
Not really, it's ridiculous.
listen to vowel sounds. Okay, then, once we listen to vowel sounds, then we go ahead and go, make sure it's soft, make sure we don't feel anything. We're not gonna go deep palpation. You just touch it, make sure it's okay, make sure she's not grimacing, make sure it's soft and non-firm. Okay, because if it's firm and she hasn't been exercising, you'll look at possible GI bleed, mass, something like that going on. All right? Then, as we're going through, we're gonna make sure she has no tubes, no IVs. We're doing that once we assess all this, okay? It's an ongoing assessment. If she has a catheter in, we're gonna note what?
The color.
The size,
Color, clarity.
okay? And you're gonna say, and you're gonna tell me, I'm gonna let you direct me. My patient has a catheter, my patient doesn't have a catheter. But I want you to note if they do or don't. If they do, then you have to follow through with if it's color, odor, amount, and consistency. Okay.
Clarity was in there somewhere.
Clarity, excuse me, yes. Color, clarity,
All that was okay.
All right. We've checked the pulses already when we did a scan. All right, you can also now do a brief neuro check on her. And you can, by talking to her, her speech is clear. You can ask to grasp my hands. Okay, side. Squeeze my hands. Okay, good. All right, you're gonna test hand grip. You're gonna, she can move everything, and all this can be done without saying, move your arm. Well, if she can move her arm to squeeze my hand, she's already got a range of motion there. Okay? You see how you can combine things into one. All right? We've checked for edema, we've talked about the catheter, we've checked for skin lesions, we've checked for incisions. If you do have, again, I'm gonna let you direct your own care. If Megan's assessing Rusty, and she says, I notice an incision on his left upper arm, she better tell me breast and coat. Okay? Now, if she says, I'm looking for incisions and I don't see any, okay then. But if you tell me they have an incision, you best go on with it, okay? Because y'all been, I'll know the ones who've been checked off and who hasn't been checked off.
So
Okay.
are you gonna tell us if they have an incision?
No, you are,
So we can have a perfectly healthy patient.
if you choose.
Okay.
I'm talking about, Chrissy, you're gonna be the
Okay.
best.
All right, we've checked ears, we've checked hearing, because she can hear everything I said. We've checked capillary refill, we've checked hand grip, we've checked vitals. That's your complete assessment right there.
Well, that's easy.
Woo-hoo, 100 for everybody.
I mean, do you see how easy it's done, how you can combine things? You don't have to go, okay, now I am going to watch you breathe. Okay? Now I'm going to listen to your heart. You want to be able to incorporate everything. That's organizing your plan of care. That's organizing what you're doing. Okay? Because it's going to help give confidence to that patient to have trust in you to know what you're doing.
So when we do vital signs, can we include our respiratory?
Sure.
Emily?
Yes. All you got to do is this is what I'm doing.
Okay.
Ms. Fox, as I'm listening to my apical pulse, I'm going to go ahead and listen to my breath sounds while I've got the stethoscope on the chest.
Okay, awesome.
How are we gonna do OT, sat, and pain? Just what they tell you their pain level is or something?
Just say if
Do you have any pain?